So in this video, I'm going to talk about 4 different ways that a keyboard could actually be causing you wrist pain and how to prevent it. And if you want to get a better keyboard for ergonomics, you can check out this video here. But the first thing you want to work on is eliminating those sharp surfaces. Now, sharp surfaces is usually an issue from working at home. Usually you want like a nice tapered surface, or if you have your desk low enough, you can actually rest your hands on the wrist rest for your keyboard, and that way you're not resting those wrists on a sharp surface. And the main issue with sharp surfaces is it's just going to cause that increased pressure over time. It can cause nerve pain, wrist strain, bursitis. And sharp surfaces are harmful because it's that single point resting on your wrist that's the issue. You want your wrist resting on something that has a larger surface area. Another thing that you can do is you can get a mouse pad for your desk, like a large one that kind of covers your whole desk, and you can rest your wrist on that instead. That's just like an easy, simple solution, or you could just get a desk that has a nice rounded surface for it. The next thing to consider is your wrist position. So always when you're sitting at your desk, your wrist should be straight, okay? So you don't want it extended, you don't want it flexed, you want a straight wrist to prevent any strain. And this is mostly for the carpal tunnel, right? So the carpal tunnel, you have this nerve that goes through the carpal tunnel, and sometimes it gets entrapped from the tendon sheath that covers the tendons here. And it's called your retinacular ligament. And a lot of times that compresses the tendons in there. And so what you want to do to prevent that from happening is just make sure your wrist is in a straight position. And also you want to avoid those in-range pronation positions. Now, this isn't like really heavily researched, but they have these newer keyboards where you'll notice that it tilts a little bit, like your hands are in a more supinated position rather than pronated position. And a lot of people are selling these keyboards. I'm not like a huge fan of them, but I think it is nice to be able to put your hand in a more supinated position. But the problem with that is a lot of times your wrists start to extend a little more when you start introducing a more supinated position to your keyboard. So the main factor here is to keep your wrist straight, and the main issue I find that people are having is their desk height it's just not the right height. I talk about this in another video where most of the desks that we're sitting at, they're way too high for us, and a lot of times when we have a high desk, our wrist ends up going in the wrong position. And so you got to just make sure your arms are at 90 degrees and in a good ergonomic position to prevent that wrist strain from too much extension or hyperflexion. Usually people have more issues with extending their wrist. It seems like most people have issues with just extending their wrist. I don't know why, but most people will really extend their wrist back, and a lot of times it's just the position of the keyboard or the desk, and it needs to be changed to kind of keep that neutral position. And it's not really easy to keep a straight neutral wrist, but really evaluate your desk and see if there's any changes to make it so you can keep that wrist straight. What I would do is I would start moving things around. So if you can change your desk height, or if you can, sometimes it's just removing like a wrist rest from your desk to kind of keep that straight position. Another wrist position issue is ulnar deviation. So this is usually for people with larger hands. What they'll do is they will start moving their hands this way, because when their hands are on the keyboard, since their hands are larger, their wrists have to go inward, and you start getting like this strain on the ulnar aspect of your hand. It could cause a lot of wrist discomfort. So the main issue here is if you do have larger hands, you probably need to look at your hands while they're on the keyboard, make sure your wrists are completely aligned in like a straight neutral position. They're not curved inward. And if you find that you do have ulnar deviation, you want to make sure you get a keyboard that fixes this problem. And what these keyboards are called, they're called a split key keyboard or a split position keyboard, where the keys are actually split out. I know a lot of people don't like these. It usually just takes some getting used to, but the keys are spread out so you can keep your hands separate, and that prevents that ulnar deviated position. And if you want to learn more about ergonomic position, I'll put a link below. So we talked about wrist position. The next thing, I kind of already talked about this, but the pronated position. So a lot of people will have their arms at an end range position. And what they say, if you actually do like a RULA assessment for ergonomics, you should never have your arms in a end range position for too much time. So what's an end range position? So if your hand, this is like a neutral position. This is where your hand should be. This is an end range position, or this is an end range position. So that's why people use those pronated keyboards. So your hand is slightly tilted to a supinated position or a more neutral position. Now, this isn't something that's heavily researched. There's not a lot of research saying that a pronated keyboard is gonna cause all these problems. When it comes to wrist pain, it's really hard sometimes to nail down like what it's coming from. I mean, a lot of mothers that have like newborns, if they're picking up their kid all the time, a lot of times they can get wrist pain from that. And maybe they associate that wrist pain from their keyboard. So it's really hard to just figure out what the underlying cause of wrist pain is. And so there could be other factors at play. And so that's why it's really hard to do a lot of studies to see if there's a different type of keyboard or a mouse that really makes a huge difference. Now, another thing that could be harming your wrist is just the age of your keyboard. If you're typing on an old keyboard that you've had for years and years, or I mean, if it's a keyboard that's older than 5 years, it probably needs to be replaced. Where I work at the hospital, I am constantly moving around to different desks and typing when I work as a therapist. And every time I go to a keyboard that just seems a little bit clunkier or it's harder to press down those keys, I immediately send a report to our IT department and have them fix it, because it is so annoying to type on an older keyboard. It's going to cause you wrist pain and strain because your fingers, the tendons from your fingers, they travel all the way down to your wrist, to your elbow. And so those tendons, if you are constantly typing all the time, you can get some inflammation, especially if you're pressing harder than normal. And this can cause a lot of strain and fatigue. And it can lead to other MSDs that can impact you later in life. So the key here is just make sure your keys are easy to press. You're not really jamming your keys here or making sure your keys do not get stuck, just to make sure that you're not causing any issues that could cause hand or wrist pain. Okay, so let's talk about some other considerations that might be causing pain while you're typing. Now, this could just be any other diagnosis. Maybe you have bursitis, maybe you have arthritis. A lot of times these older patients with arthritis are just gonna have wrist pain because of that arthritic position and moving the fingers and the wrists. You might have carpal tunnel if you have that numbness or tingling. Another issue that people will have is cubital tunnel. So if they have any, it's usually numbness through their ulnar nerve at their elbow, but this can actually cause pain all the way down through the wrist. So this is something to consider. As I talked about earlier, people that have newborns or they're lifting their kids a lot, they could actually have something that's called Decravane's tenosynovitis. This is usually pain right down the thumb in this area right here. This can happen from people that are scooping ice cream. This can happen from people that just put their hands in weird positions. I knew somebody that the way she put her purse on, she did this motion all the time, and it causes wrist pain and discomfort right over her thumb. You could have this same type of pain if you're playing tennis and you're serving all the time. If you notice any of those symptoms, that could be a sign of tenosynovitis. And what you need to do in those cases is sometimes it's like bracing is helpful. And so there are a lot of other things that you might want to consider before changing your whole workstation setup. But for the most part, if you want to prevent wrist pain, I think it's all about making sure you have that wrist in that nice neutral position. You don't have any sharp edges. And if you have larger hands, you want to just make sure they're in a straight position and not ulnarly deviated. All right, guys, so I hope you found this video helpful. Please like, subscribe. I'll see you in the next one. Have a great day.